Good evening, doctors. Welcome again. Today we are going to discuss about psychiatry part 2, part 1, MRCP. This is B section. 23-year-old woman sustains a minor limb injury, okay, while intoxicated with alcohol. This is her third emergency department visit in a month. She treated with assessed as a sober and a safe for discharge. She scores 4 out of 16 as a fast alcohol screening test, which is the single most appropriate initial management here. So the answer best is offer a brief intervention. Let's discuss. Okay. Yeah, we start discussing now. The most appropriate management is to offer a brief intervention. The FAST is quick screening tool with sensitivity 23% and specificity of 88%, detection of hazards drinking compared to the case cautionary. The cutoff clinical significance 3 by 16 points on a FAST. By scoring 3 plus, the patient falls into the hazardous drinking category at least. There is a good evidence for screening and brief intervention in ED or primary care setting, reducing hazardous drinking by 17%. Okay, hope it's clear. Now let's discuss another MCQ. A 78-year-old woman has recently diagnosed with depression. She started using St. John's wort remedy to help improve her low mood. What is the single most relevant advice to give her in such condition? There may be a significant interaction with her other medications. Okay. A 24-year-old woman is dependent on heroin, confirmed by two positive urine drug screens. She wants help to stop injecting and sort her life out. Would like to have a clear head. Which is the single most appropriate drug to prescribe? So the single most appropriate drug for heroin, that is oral buprenorphine. Okay. A 35-year-old woman. A 35-year-old woman is transferred from inpatient psychiatric unit with a fever, rigid muscles, sweats, tremors, fluctuating BP. She started a depot antipsychotic 3 days ago. Which is the single most appropriate blood investigation? Here the single most best is creatinine kinase. Let's discuss here why this so. Okay. Sorry guys. Let's discuss the question test. Appropriate investigation for neuroleptic malignant syndrome is a rare life-threatening idiosyncratic reaction to antipsychotic medication, characterized by fever, muscle rigidity, altered mental status, autonomic dysfunction, high potency antipsychotic, and depot preparation is non-risk race CK. Okay, so hope now you understand why this is. Okay, let's move another MCQ. 83-year-old woman with Alzheimer's dementia who has recently started taking donepezil is reviewed in the memory clinic. Which is the single most appropriate observation to review the pulse? Pulse is important. With donepezil you have to review the pulse. Okay, now an 83-year-old woman with severe Alzheimer's dementia lives in a nursing home. Staff report that she is stable and presents no problem to them. Her MMSE2 score is 9 by 30. Her list of medication is being reviewed. Which single medication is appropriate to stop first? So here we are going to stop first is simvastatin. That is simvastatin. I forgot to explain discuss 16th, so let's start discussing the 16th MCQ. A 51-year-old man is unwell on 2 days of attempted home detox from alcohol. He brought to the emergency department by his partner who is seeking help. Diagnosis delirium tremens is suspected. Which single feature is most suggestive of this diagnosis? That is clouding of consciousness. Delirium tremens is an acute confusional state. Okay, so this 17th we discuss why simvastatin to stop first. Okay, now visual hallucinations are one of the three core features Lewy body dementia. Visual hallucination typically well formed and not particularly distressing. Fluctuating cognition with variation, attention, alertness, and spontaneous feature of Parkinson disease. Present for less than a year before cognitive problems, falls and syncopes are often a feature of presentation of Lewy body dementia but are not specific for the diagnosis. Falls often occurs because the patient gait and imbalance are affected by the motor symptoms. Parkinson REM sleep disorder is a commonest feature of Lewy body dementia. Okay, so hope explanation is understandable for you. Now a 54-year-old man is found in his street drowsy and vomiting. He unkept strong odor of alcohol, is ataxic, verbally aggressive, slurring his words, temperature 37.5, heart rate 96, BP 115 by 87. What is the single most appropriate diagnosis to exclude? Exclude here is head injury. Head injury. Okay. A 74-year-old man feels tired during the day but does not know why. His wife says he is up overnight fighting with the bed sheets. At these times tells her he can see snakes. They have put padding on the bedside table to prevent injury. What is the single most likely diagnosis here? So here the diagnosis is, this is a case of REM sleep disorder, rapid eye movement sleep disorder. Okay, 55-year-old woman is bipolar disorder, has a seizures. She has never fitted before. Her husband reports she had a 3-day history of tremors, nausea, vomiting, muscle twitches, bloody diarrhea. Before they boarded their flight home from the holiday in Egypt. Which is the single most likely cause? This is a cause of lithium toxicity because she is bipolar disorder on lithium. So lithium toxicity results such symptoms. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me. If you're new on my channel, please subscribe it. And if you like this video, put like on it. Thank you. Good day. Goodbye. That's all for